Naisha More. On the occasion of Doctor's Day, I am here with Dr. Rajdeep More, who is a gastroenterologist and liver specialist. For those of you who may not know, he also happens to be my uncle and is my go-to person for all issues related to my gut. So let's ask him a few questions about our digestive system health and do's and don'ts, which I'm sure will benefit all the kids and adults out there. Welcome, Dr. Rajdeep More. To start with our first question, can you tell us a little bit about what is gastroenterology and a little bit about our liver?
Yes, first of all, thank you Naisha for having me here on the occasion of Doctor's Day. So gastroenterology and liver, the study of liver basically involves a comprehensive study of your entire digestive system, which involves the stomach, the intestines, and it helps us understand how the digestive system functions. The study of the liver is primarily to know what are the functions of the liver as well as what are the things that cause inflammation, swelling or damage of the liver. So basically gastroenterology and hepatology, or the study of liver disease, involves a comprehensive study of your entire digestive system.
Moving on to our next question, how does gut health affect overall health and well-being?
Well, yes, gut health impacts your entire body. So most importantly, a good gut health helps in good absorption of food as well as absorption of all the nutrients which are required for the body. Secondly, if your gut health is impacted, it can lead to significant weight loss or excessive weight gain, which is not healthy for your body. Apart from that, the other organs of the body, such as the heart, kidney, and the brain, are also affected by a good gut health. And last but not the least, there is a significant association between mental well-being and having a good gut health.
Okay, next question. Can gut health impact mental well-being and cause stress?
So yes, in today's time, stress plays a very important factor in many individuals' lives. There is something called as the gut-brain axis, where the nerves coming from the brain are connected to the gut, and any signals that the nerve sends affects the gut health and the movement of your digestive system. So studies have shown that if patients have a lot of stress or anxiety, it adversely impacts their gut health. It increases the amount of bacteria or the bad bacteria that are there in the gut, leading to various diseases and symptoms. So yes, definitely there is a strong correlation between your mental health as well as the gut health.
Moving on, are there any specific foods that can harm your gut health?
Yes, there are some specific foods which can adversely impact your gut health. Most importantly are the processed foods, whether it's the processed meat or refined sugars, high saturated fatty foods that can cause significant amount of damage to the gut health. Then fried foods, carbonated or aerated beverages like sodas or soft drinks, they can also affect the gut movement and impact the gut health. Hence, it is very important to know these triggers if you are suffering from any gut issues, and whether you have any of these triggers of the foods that are causing your symptoms related to the gut health.
Next question. Now, what about some steps we can take for promoting good gut health?
Yes, so there are a number of things that you can do in your daily life to promote a good gut health. Most important are your lifestyle changes. Adequate sleep is one of the most important factors that determines a good gut health. Secondly, adequate intake of water. So unless you have some certain cardiac conditions or any problems with your kidney or the liver, you should at least consume about 3.5 to 4 liters of water every day. That is very important to maintain a good gut health. Daily exercise. Now this is something that we all know about, but we usually ignore. Daily exercise for about 45 minutes of brisk walk along with other aerobic exercises definitely promotes a good gut health. Then regarding diet, a diet rich in fibrous foods which consists of moderate amounts of fruits, vegetables and legumes is definitely beneficial for a gut health and overall well-being.
What foods do you recommend for your gut?
So as I just mentioned, that the diet should be high fiber diet. It consists of legumes, fruits, vegetables in moderate amounts. If you are suffering from any other intolerances such as dairy products, that should be avoided. There are some addictions that definitely worsen your gut health, such as smoking, alcohol, so that should be completely restricted. So this is all that is required to maintain a good gut health.
For our next question, in today's age, we eat so much junk food, I'm sure we all experience bloating and stomach aches. Can you tell us what leads to that?
Yes, this is one of the most common symptoms that patients come to me with, having bloating and facial distension. So there are a number of factors which contribute to bloating. The most important, as we discussed now, are the processed foods and refined sugars and soft drinks, aerated beverages, which definitely cause a lot of bloating. Apart from that, there are some illnesses and medical conditions, such as an irritable bowel syndrome or overgrowth of the bacteria in your intestine, which break down the foods and release a lot of gas and cause bloating. Apart from that, there are some medications which can cause this kind of bloating. There are other inflammations in the intestine which cause damage to the lining of the intestine, which can cause significant bloating and gas. So it's very important to visit a gastroenterologist and seek opinion regarding what is exactly the cause of this bloating. So in such cases, we have to usually do an endoscopic procedure and take a biopsy and find out what is the cause of the bloating and the facial distension.
What are some of the alarm signals that are related to gastroenterology when someone should visit a doctor?
Yeah, so the gastric symptoms are very, very common in day-to-day life, such as acidity, acid reflux, bloating, gastric distension. However, there are some GI symptoms or some symptoms related to your gut which should not be ignored, and you should visit the doctor at the earliest. Some of the most important ones being if there is gastrointestinal bleeding, if there is significant weight loss in a very short amount of time, if there is difficulty in swallowing solid foods or liquid foods, if there is a sudden abdominal lump, if you feel a significant swelling in your abdomen which is out of the ordinary. So these are all the conditions in which you should visit a doctor, especially a gastroenterologist, to probably evaluate with an endoscopic procedure to know why are these symptoms, and timely diagnosis and intervention could really help the patient.
That was some very good information about our gastrointestinal system.